My name's Dan Adams. I'm an ortho PA for the University of Colorado. I've been one of the floor PAs for about 4 years now. Pain control is very important and a high priority and concern for the patient, rightfully so. Reasonable goal for the pain while inpatient, I would like to have between a 4 and a 7. It's not going to be a 10, it's not going to be a 0, but we want to find that middle ground. Goals for discharge, number 1 is pain control. We want to make sure the pain is controlled and what they're taking here and what they'll go home with. With some of our surgeries, it is important to maintain a diet, be able to drink fluids, be able to eat food. It's also important that our patients are able to maintain their hygiene and be able to take care of themselves when they go home, and those are things that physical therapy and occupational therapy will help assess. After surgery, many of our patients will have a Foley catheter. We try and get that removed as quickly as possible to help prevent any types of infections. But what's important with that is also mobility, because we need to make sure they are able to safely mobilize to a commode. Regarding constipation, some of our surgeries can have an effect on the bowels, so sometimes we do want patients to have a bowel movement or pass gas before discharging.
The expectation is that you will get up the day after surgery and multiple times throughout the day for all the days that you're in the hospital. So I think one of the most important things to know after this type of surgery is that getting up and moving is going to be so helpful to you in multiple different ways. It actually helps with pain, which seems a little bit counterintuitive. We do our very best to coordinate our therapy sessions with your pain medication, but actually moving can help with your pain. It will also help prevent other complications of this surgery like blood clots or constipation. You'll be seen by a physical therapist the day after your surgery, and we will be helping you learn how to get in and out of bed using the log roll technique, be able to stand and transfer to a chair, be able to walk. The goal is usually about 150 feet prior to the time you go home, and then to be able to do stairs if you need to do so at home. If you're needing quite a bit of assist for those tasks, or if you have very limited social support at home, we will likely recommend that you go to an inpatient rehab facility for a short stay. That will be determined after your PT and OT evaluate you and will be set up by the case manager or the social worker. It's largely dependent upon your insurance where you can go, but it's not something that can be set up ahead of time.
From an occupational therapist perspective, the day after surgery, we want to see you get up out of bed. We want to help you start living your life again. Long term, as we look towards leaving the hospital, we want to make sure that you can do the things you need to do to take care of yourself. So whether or not you have help at home or you want to live independently, we're here to help you figure out how to do your daily living skills safely. Your doctor may prescribe a brace. Some doctors like braces, some are a little bit more liberal and don't recommend a brace. We will work with you to figure out how do you get your brace on yourself, how do we make sure it fits well, how is it comfortable for you, and then we'll also make sure that you're wearing it at the appropriate time so that your skin doesn't get sores, that it doesn't get wet. So now that you have spine precautions, it may seem like it's going to be very difficult to do your daily living skills. How do you put your shoes on without bending over? How do you empty the dishwasher without bending over? How do you get in and out of the tub safely? Occupational therapy will work with you on how to do these things, but we also sometimes recommend equipment. And insurance does not pay for equipment in most cases. We have options for vendors, we have options for loaners, and we have options of where you can buy things. And we'll work with you closely on figuring out what's the best option for you. In order to discharge to home safely, if that is your goal, we want to make sure that you have the energy to do what you need to do. You're not going to fall, and that you're aware of your rules and safety while your spine is healing. And as you're doing your daily living skills in the hospital, we'll make sure that you're incorporating rest breaks and fall prevention techniques so that when you go home, you don't have to worry about those things.